Hello and welcome to our presentation, Culturally Sensitive Mental Health Support for Higher Education Staff in an Era of COVID-19 and Hypersurveillance. My name is Luke Swiatek and I lecture at the University of New South Wales, or UNSW Sydney.
And I'm Dr Ursula Edgington, independent scholar currently based in Toronto, New Zealand.
At the outset, I'd just like to acknowledge the traditional custodians, the Bejigal people of the unceded lands on which the UNSW Kensington campus stands, and I pay my respects to their elders past, present and emerging. Always was Aboriginal land, always will be.
Thank you, Luke. Tēnā koutou katoa. He mihi nuhi kia koutou. Nā kai rangahau. Nā kai ako. Nā akonga hoki. Tēnā ra koutou katoa. And I'd just like to acknowledge the Te Reti o Waitangi responsibilities that we have as researchers and teachers and learners, and that we welcome any feedback and comments regarding our research at the end of this presentation. Thank you.
The presentation is divided into several parts. We'll begin by explaining how the research came about, and we'll connect it with the growing issue of hypersurveillance, linking that to wellbeing and mental health concerns in higher education, as well as the impacts of COVID-19. After that, we'll present our research question and method, as well as the results. The discussion will follow, in addition to some recommendations for higher education institutions in Australia and Aotearoa, New Zealand. And at the end, there will be an opportunity for you to engage with us and the research if you'd like. The research basically began with a contribution, a chapter, to the forthcoming book, Mental Health Among Higher Education Faculty, Administrators and Graduate Students, A Critical Perspective, being edited by Teresa Heinz-Hausel, soon to be published by Lexington Books. And it also built this research on our existing research relating to toxic workplaces, including our research into bullying and harassment in Aotearoa, New Zealand, that we presented, for instance, at the Culture Shift conference not too long ago, as well as research into culturally sensitive onboarding approaches in universities. Higher education institutions, as we know, have a need and responsibility to provide culturally competent mental health services, given the increasingly international makeup of their workforces, something that hasn't changed despite the COVID-19 pandemic. However, universities have faced growing criticisms for not having effectively met the needs of their increasingly culturally diverse staff, and for not having provided enough mental health support for their employees. At the same time, what we've found over the years is that the issue of hypersurveillance has continued to grow, and it has really impacted staff well-being, including mental health. And for a number of years, the two of us have been reflecting on this growing hypersurveillance that we've been experiencing, and we've been exchanging anecdotes about it. And three stand out for us in particular. Our inboxes being monitored, and we know and we've seen that they've been monitored. Academics asking each other, our colleagues asking each other to use personal email accounts rather than institutional email accounts, and insights into email usage and our work patterns more broadly being provided to us now on a regular basis. And all of this very much connects to the quite problematic issue of hypersurveillance.
So just to pick up on the hypersurveillance issue and the connections, because it is very complex, the interrelated nature of these issues that we're investigating. And so the fact that a hypersurveillance might have an impact on whether staff seek help for their mental health issues is relevant for every sector. So it's not just in universities. And in terms of a definition of hypersurveillance, there's one there that we found from the RSA report 2019 about analysing all kinds of different information and how that creates value by capturing and analysing that information. And so we're not going to, we haven't got time here to spend too much talking about that, but there are lots of other additional details available on the form that we'll put a link to at the end of the presentation.
And indeed, just to build on that very briefly, what we've seen is universities becoming more and more entangled with vested interest. And what Kirsty Lyons has pointed out recently is the fact that the spread of different problematic managerial practices has created a workplace culture of hypersurveillance. And this feeds into the issues that are being experienced in multiple sectors where staff are simply, because of hypersurveillance, because of the managerial practices, they're too scared to speak to an employer or a manager about their mental health issues. They're too concerned, because of hypersurveillance, to go and seek help, especially online available help to address those concerns. And that is an enormous impact. And the mental health and well-being concerns that we're seeing in multiple sectors are very, very much being reflected and growing in higher education. And over time, it's so important to stress that academics and higher education staff, more broadly, their well-being, including their mental health, has received far less attention than that of students. We're not for a second saying that students' well-being and mental health aren't important. We're saying that staff simply need to be given more care and their needs need to be met, given how crucial they are to universities and their work. One particular set of academics has found that around 43% of academic staff now indicate at least some sort of mild mental disorder, and we have no doubt that that has increased due to COVID-19. And the once-in-a-century global pandemic, as we know, had impacts on multiple areas of the sector. It impacted students enormously by increasing their stress and anxiety, depressive thoughts, and so on. But it also impacted staff who have been experiencing chronic stress, workplace burnout, secondary trauma, as well as additional caring responsibilities.
So moving on to what our research question was, we looked at evidence of the culturally competent mental health support that was available for staff in higher education institutions. So we looked at the policies and other organisational communication collateral that was publicly available. And the method that we used was qualitative content analysis. So we looked at the data and we established some identifying themes and patterns, and the findings that we'll discuss in a moment on the next slide. Here we go, results.
Exactly, this table very much shows what we found through that research. We just need to point out that from left to right, you see the universities presented in alphabetical order, starting with Aotearoa, New Zealand, followed by Australia. And we divided the different forms of mental health support that we identified into two broad categories: internally available and externally available forms of support. And we subdivided those two broad categories into further categories based on our findings. The first category was universities offering an employee assistance program. And as the table shows, this was absolutely the main form of mental health support that the universities provided. And indeed, for some universities, it was pretty much the only form of mental health support that was listed online as being available to staff. The next category that we identified through our findings was universities offering other mental health support services for staff. After that, another category was universities holding an annual mental health week, month, or day that was promoted to staff as well. Another category was universities holding general mental health related events for staff, and universities running more specific mental health related training for staff. Another category too was universities offering their own publicly accessible mental health related online courses. Another was universities providing links to external mental health resources. Another category was universities providing text-based mental health information and advice. And the final category was universities having a specific or standalone mental health strategy or plan. The table shows that different publicly accessible forms of mental health support were patchy, and that universities generally simply referred staff to the employee assistance program. And this is problematic, of course, in a time of growing hypersurveillance and for the fact that staff need to log in to university portals to access the details about those employee assistance programs. Two universities we want to highlight did make an effort to recognise the importance of diverse cultures or ethnic diversity in terms of mental health support staff. The University of Canterbury's Wellbeing strategy features bicultural models of wellbeing, and Western Sydney University's Mental Health and Wellbeing Pack for Staff contains information specifically relating to culture. And we sincerely hope that since this data was collected, more culturally sensitive, publicly available forms of support are now being provided for staff.
So just to draw our presentation to a close, the discussion issues really centre around what the different needs are of the staff. One thing that really came out of the analysis was that it was very unclear, even when there was provision for mental health resources and support, how culturally competent that resource or support was. And this is especially relevant in the COVID-19 era, where redundancies and increasing concerns about budgets, etc., and the elements of hyper-surveillance that are connected to that make externally available forms of mental health support problematic. So yeah, that word culture is often used in connection with institutional workplace, the workplace culture. It's not necessarily used in the way that we would like to see it interpreted, i.e. the cultural needs and the cultural sensitivities involved in mental health support. So our recommendations, definitely there should be more publicly available dedicated sector support resources, specifically for staff that are now maybe more staff on 0-hour contracts where they can't necessarily access those intranet support services. Resources definitely need to be more culturally sensitive in an explicit way, and mental health support needs to cover staff that have been made redundant or about to be made redundant, because that comes with its own anxieties. And Luke, do you want to finish off?
Absolutely. We also, as we mentioned before, need to remember a crucial but often forgotten fact that staff are absolutely pivotal to universities. We often think about students, and quite rightly, we do need to think about students and their needs, but we forget that staff are on the front lines, and more research is absolutely needed to make sure that staff are being properly looked after in the course of their duties, which we know too are increasing year by year. And then finally, inter-institutional mental health support is also very, very important, and we would encourage more of that to be available.
On that note, we'd just like to add that in our chapter we have some support resources available, and we can make those available on our Google form.
On that note too, turning to the Google form, we absolutely welcome your comments, questions and suggestions about the research. To contact us, just head to the tiny URL link provided there on the slide. We're aware of the fact that the Google form sometimes doesn't work on some browsers. So if you're experiencing any difficulties in accessing that form, if it's being blocked, just try to use another browser. It's been an absolute pleasure to have shared this research with you, and we thank you very, very much for your attention and time. And if you'd like to engage with us, we thank you in advance for that as well.
Thank you for listening. We look forward to hearing from you.